Hey, what's up everybody? So I just wanted to make a video about how you can help your pharmacist. So I now have the fortune of working in an industry that is like one of only a few industries that they're telling us that we have to go work at. So I don't get to be quarantined. I don't get the big snow day that a lot of people are getting, which is great. But I just want to talk about how you can help your pharmacist. Obviously, we're going to be diluted with a great deal of volume of prescriptions, and if everybody starts getting sick with coronavirus, a lot of people will be treated as outpatients, and we're going to have to deal with that. So one thing I want to ask of, just generally ask of people is, you know, there are some things you can do to help us. We're not going to be able to fulfill every request the same as we used to, and what I mean is it would be great if you could give us a little bit of a heads up if you need a prescription. I'm talking about like if you have a maintenance drug, a blood pressure medication that you need, give us a day or two to get that ready for you. You know, look at your medication now, call in your prescriptions, and give us a little bit of time to have that filled. And that way we'll be able to make sure we have it in stock for you, and you won't have to wait around with a crowd of other people who are giving you all of their germs. And just as an aside, you know, I work in a grocery store, and I was thinking to myself, so I had a couple days off, but the last time that I worked, a few days ago, that was when the governor, I work in Maryland, the governor of Maryland closed all the schools, and that's kind of when you saw a lot of panic buying of toilet paper, eggs, milk, other essential goods. And what I was thinking at that time was, this is really a great way to spread an illness. Everybody rushing to one place, breathing all over each other, waiting in line, touching the self-scan machine, and it's really the perfect way to really accelerate the spread of an illness. So one thing you can do is, you know, when you go to the pharmacy, you're likely going to come into contact with other sick people. So you want to kind of reduce the amount of time that you're going to spend. So give us a couple days to fill your prescriptions. Utilize technology. A lot of us will text you when your prescription is ready. Wait till you get that text. Don't bum rush us, which is what a lot of people like to do, which is fine under normal circumstances, but under these circumstances, we would ask you to be a little bit more patient. Utilize technology. So a lot of us have IVRs on the phone, we have apps. Try to use that. I know we like to talk to you, but right now it's just very busy. We're swamped. So use the technology to call in the prescriptions and wait, you know, till this whole thing passes and we can, you know, catch up and everything. People are gonna get sick, they're gonna have to go to their doctor's office, and they're gonna have prescriptions sent over to the pharmacy. We need a couple of hours. I know your doctor tells you that, oh, it's ready now, and you can come to the pharmacy and get it, but your doctor doesn't know that. And give us a couple of hours because you're going to be extremely busy. And again, you're going to be sitting in a waiting area with a bunch of sick people, and you're going to be exposing yourself. So let's say you have the flu. You know, you're going to get something on top of that, and you might get pneumonia. You know, these kind of things just reduce your risk, reduce the amount of time you need to spend in a store or around other people. Try to get 90-day supplies from your doctor for your maintenance medication. A lot of doctors are old school. Seems to be they like to fill 30-day supplies. My doctor is one of them. I have a maintenance inhaler that I use, and he seems to want to fill one inhaler. So every 30 days I have to get a refill. It's like, I've been on this for like 10 years. You know, keep in mind that, you know, we can ask your doctor for a refill, we can fax things, but if it's a special request you want us to call your doctor, think about whether you can do that yourself. Just at the time, we might not be able to get to it, so you might be frustrated with us. So if you can make the call yourself and you're quarantined anyways, call the doctor. Be flexible with us. You know, we might not remember you get the Tiva brand or this brand or that brand, and also keep in mind that there might be a coming supply shortage, and there might be issues getting certain manufacturers in general. I know that there already are some issues. The CDC hasn't said which manufacturers. I haven't seen specific widespread drug shortages yet, so I'll see when I go to work if that's the case. But for now, be flexible. Maybe be flexible with manufacturers, but be flexible if we don't remember. You know, we can always try and accommodate you. And keep in mind, we're slammed and we're understaffed. We're staffed for a normal business period, and as you know, pharmacies in general keep their staffing very kind of tight. It's not like a hospital pharmacy where they have a lot of extra hours for people. In retail pharmacy, they try to keep the staffing pretty on a tight leash and control their costs by keeping their labor dollars low. So keep that in mind. And if you're sick and you have a spouse, maybe your spouse is a lazy bum, doesn't want to get off the couch, wants to enjoy the quarantine and get through Killing Eve or whatever, try to get them to get the medicine for you if you're sick. You know, pharmacy is going to turn into a great place to spread disease. There's already been a CVS pharmacist in New York who's contracted coronavirus. I don't want to get it. You know, I'm in my 30s, so maybe I wouldn't show symptoms, but maybe I'd give it to all my older patients. So keep that in mind. And be kind. This is a time when Americans need to come together. We need to help each other. You know, reach out to those elderly people in your life and see if they need anything, and just come together. So I hope you all found this interesting and useful. If you did, please give me a thumbs up and please subscribe. I want to thank you guys for watching. Thanks a lot.